What's up, everybody? It's a weird looking background. I don't know how to change that, but that's okay because I'm going to change my screen. So, welcome everyone. If you're members or you're not members, you might know I do a lot of these like little clinical gems. I do some really long webinars, but tonight we're just going to do like a clinical gem. I see a lot of members on my site have me go through their notes, and all these docs are incredibly smart docs. The hard part is taking what we have in our head and what we know about chiropractic, which is obviously incredibly powerful and important, and trying to get it into our notes, right? Because if it's a personal injury case, and even if it's not, I want everyone to use this site for every patient. But you're only as good, well, I don't want to say you're only as good as your notes because that's not necessarily true, but God forbid something happens. You get questioned. Why'd you do this? Well, why'd you image them? Why do you think this is a problem? Your notes are only going to be your first line of defense. It's called the Etherton Law. The Etherton Law states you're only held to the four corners of your notes. So let's start with day one, putting it in there, putting it in your notes. And I'm going to show you very simple, quick, easy ways. And we're going to go over this pretty quickly. So I made a PowerPoint. Most of it's going to be me talking, and then I made a couple of videos just to kind of show you. And then we could do a Q&A afterwards with any questions. And then we're not going to get super deep into this because I've done this. I have really, really deep webinars on lots of these topics. Like, I've gotten over my whole deposition and my whole trial testimony, going over my notes, which is like an hour and a half, 2 hours long, showing you questions they asked about my notes. All that's in super detail. I just want to give you all like, okay, you took an image, you took an x-ray, you took an MRI, and you sent the patient out for it, or you took it in your own office. Okay, big deal. Now what? What do your notes show, and how can you validate the treatment and what it actually means? So let's get to it. I don't want to take up all your time. I know it's, long day and you were working and all this other great stuff. So let's kind of get into this here. Um, all right. So I don't know what, documenting images using professionally integrated. So I started this because within the last 2 weeks, I had a lawyer contact me about saying like, "Hey, can you call this chiropractor that they sent to us for an image?" The chiropractor never did anything about it. They didn't put it in their notes, and this is like 6 months after the fact. So now the lawyer is like, "We can't really bring in what the image showed. Can you call that provider and talk to them?" And I'm like, "Look, I'm not doing that." Right? Kind of at the point in my career where I'm like, "Listen, I'm real busy. We're all real busy." He had the opportunity to reach out. He chose not to. That's on him. This isn't my patient. And it sounds kind of messed up, but I was like, yeah, the patient should be pissed. And then this was from a lawyer, another lawyer that's actually a member of the site, who's like, "Hey, thanks for all this hard work. You put together so much stuff on your site, and we just want to keep constantly educating docs because he runs into this problem a lot with getting notes from chiropractors and like, I can't really fight this because none of this is in here. How do we get better?" So if you take or you refer for an image, what do you do? So I went over some real world that just literally happened 2 weeks ago with that doc I was just talking about in the beginning. So you can't just put the report in your notes, like in the file, right? So let's say it's an MRI and the radiologist sends it back and you're like, "Okay, cool." You could do that, but so what? You need to do more, right? And I'm going to show you what that means. Don't just be like, "Oh, the radiologist report is in the file. I'll talk about that." No, if you're being asked in a deposition or someone's looking at your notes, okay, that's what the radiologist said. What do you have to say? What's the chiropractic aspect? What's your aspect? A radiologist doesn't know what it means. They don't know the potential causation. They don't know what type of treatment. That's not for them to decide. They're like, "You're the provider. Here it is. Now, how do your notes reflect that?" For me, and I've mentioned this a bunch before, I always put the picture of the pertinent image in my soap note. It's on every page. It just follows over. I can briefly look at it. So when I'm getting ready to work on the patient, if that helps you, um, if that helps you understand what you're going to adjust, you can quickly look at it. If it's on your computer, you can show it to your patient really quick. Hey, is your neck again? And then I've also had times where IMEs were like, I didn't see the images. I went through all the notes. I never got the images. And then I'm like, but you got my soap notes, right? They're like, yeah. And I'm like, well, you're lying because it's on every page of the soap note. And I like to just have it in there. It can't be ignored, right? They can't say we never got it. If they got your notes, they got the images because there's a picture on the bottom. And you want to discuss the findings. You want to discuss them with your patient, at least I would hope so, but you also want your notes to reflect it. And if it's in PI in the beginning, why do you think the crash caused it? What's the causality of it? Make sure your notes reflect it. Hey, I sent out for an MRI and it has, or an X-ray and it has 6 findings. Okay, are all 6 part of the crash or some of it? What are, let's talk about that. Let's make sure your notes reflect that. And what is the long and short-term consequence of that finding, right? Why is your treatment necessary, right? Let's get into the long-term issues so that you can validate your necessary long-term care if they need it based on objective findings. So here's a recent example, okay? We're not going to get into how terrible I think this soap note is. There's a ton of webinars on soap notes, how to do soap notes, what I think your soap notes should look like. My soap notes stand up in court over 50 times. This is not it. But this was February 5th. Okay. This is the docs notes that the lawyer sent me February 5th. February 7th, they had an image done, right? That we did. We have a digital motion x-ray, and I'm going to talk about just the static aspects of this. February 7th, we found, and we're not going to get into all the pathologies. There's tons of webinars and there's 300 hours, I think, of content talking about each of these pathologies. We're not going to go over all of them. We're going to take little clinical gems of this. So here's one thing that it showed. Here's another thing that it showed, February 7th. Here's another thing that the report showed, that the image had, that you have in your office, even if it's just the side views, the measurements. This is what the doc had. Here's their soap note, the next visit on the 12th, February 12th. What does it say? Nothing about the image, nothing about the findings, nothing about the causality, nothing that it was ever done. So now this patient is kind of screwed because the provider, whether it's you or me, said, I think you need an image, whatever that image is. But then the image wasn't important enough to put in the notes or to discuss or even say that they talked to you about the image. So let's get into that a little bit. So let's start with that first view. So right here, and I'm going to ask you, right, and you can go into the Q&A. I'll get to that in a little bit. So what do you do? What do you say, right? So that let's say you took an X-ray in your office. This patient was in a crash and you see this. What are you going to put in your notes? Let me show you some very quick, easy things that are going to protect your ass and protect your patient to give them the care that they need. So here's a video that I made, and I'm just going to show you how I did this. I thought it would be easier if I videoed it. So let me just show you so I'm not. All right, so this is how we do it. Super simple. Let's say we loss of curve. You're going to come to the library. You're going to go down on one of the diagnosis. One of them is loss of curve. And then under each of them, you're going to go to causation, right? Because we're going to start with causation. Why do you think if it's a P crash caused it? And tons of stuff comes in, right? Look at all the pages as it just relates to causation. This is a paper that we just recently published. But look, here's one cervical buckle, right? All this has to do with car crashes and buckle. We're going to scroll down. Everything that I have here in bold has something to do with the paper. So it's not just a quick remember, right? We want to understand this. You want to listen to the videos while you're on the way to work, sit on the toilet. I don't care, but listen so you understand it. The more you understand it, the more you can discuss it, educate. But right here, look, you're going to pick one of these that talks about during compressive loading, the cervical spine axis segmented. Copy, paste, references down below. This one I do mention from the CDC,
Well, look, this is right from the Department of Biomechanical Engineering and Orthopedic Surgery at Duke University. You're going to quickly take those, drop it in your notes that discusses this curve, why you think that was from the crash. You have causation done, right? I will sometimes put one to two, and then throughout the course of care, maybe I'll put another one up, right? Maybe I'll say, hey, I spoke to Mary again. I talked to Mary. I wanted to show her. Here's one that, again, that paper that I published with 41 X-rays before and after a crash. Talks about what it is. This is from, journal diagnostics, right? Copy and paste something, put in the notes. Now you understand why the crash causes it. Your notes reflect the loss of curve causation, right? Then from there, we can go even further. Now we can start to say, okay, well, let's go to loss of curve causation. Let's get that out there. Now we want to talk, maybe the patient has neck pain. Maybe they have headaches. So you can go up here and just type in loss of curve and headaches or loss of curve and neck pain. So let's just do that, right? Patient has axial neck pain. So let's say kyphosis, right? Kyphosis and neck pain. So boom. And then right from here, look, there's webinars that I did on cervical kyphosis after a crash, kyphosis and degeneration and pain. So let's just say we're going to go to this one. Both things. You have kyphosis. Look, cervical kyphosis mechanically influences the intervertebral discs, which may lead to neck, shoulder, and scapular pain. Maybe your patient has that. Maybe on the image or their images on an MRI, they also had a loss of curve and disc pathology. So look what it says. Copy and paste, put it in. Having grid, so we show that measurements are normal. And here are some of the highlights. Look what it shows from Journal of Musculoskeletal Sciences. Cervical kyphosis mechanically influences their intervertebral discs. Kyphosis may lead to neck, shoulder, and scapular pain. And kyphosis was present in 60% of the patients with pain and radiological degenerative disc disease. So your patient you mentioned they had loss of cervical curve. You discuss causation if it was after a crash, and if it's not after a crash, show your patient this. Oh, you're diagnosed with disc pathology. Yeah, you also have a loss of curve. Two things are linked. And that's not just me saying it. Yes, I see it in my office, but this is also what Journal Musculoskeletal Science and Practice discusses. Drop some of that in your notes, sentences here and there. It's that simple to do. So we can continue to add on to the causation, add on to their symptomatology and pathology, and discuss with your patient, educate it. But now your notes are reflecting one finding on that X-ray.
Okay, does that make sense?
Well,
Right? So let me show you the quick soap example. Right? So that whole thing that I just showed and went through, we do for every patient. You took an image. Okay, explain to me what's on it. And if you send me your patient with those images, your notes should reflect like this is okay. Now your notes are there's a car crash. You explained clinically why you think it's from the crash, and we can get into the predisposing, the health history. We go all over that in other webinars. But now it's like your notes, let's say, showed that paper from Journal of Biomechanics, paper from Journal of Diagnostics that show car crashes have been shown to cause that. So you took an X-ray, loss of curve. You now validate, hey, patient had loss of curve. Boom, quickly copy paste, drop something in there. Drop what part of that paper makes sense more than just a sentence or a macro. Now your notes, when you send it to the lawyer or you send it to another doc, and now 6 months from now, a year from now, the insurance company or someone's fighting you. Well, why do you think that's a problem? Or the IME says, I looked at it, I don't think it's a problem. That's not an issue. That's not true. Crashes don't cause that. You're like, well, how come you miss these references from day one? You establish some causation based on scientific literature. Over their opinion, bring that all day. So here's a quick soap example. And again, we have lots of soap and documentation webinars. We're not going to go over all this, but let's just say it was like this. Hey, on that same day of soap, I copy and pasted, I took a picture of their neck with the measurements. I already have the full report, which I can talk about, but now I'm talking about certain aspects of it. Mary was involved in a crash. Crashes cause buckling. Boom. Here it is right here. Centers for Disease Control and the Department of Biomedical Cervical Engineering. Hey, cervical kyphosis mechanically influences the discs from Journal of Musculoskeletal Sciences. That's now part of my notes. So when someone argues the IME is like, I don't think it's a big deal. You're gonna be like, I don't, that's totally fine that they don't think that, but that's not what the literature shows. And why do they ignore Department of Medical Engineering from Duke University from Journal of Biomechanics? Why they not look at the reference I put in there about how that pathology leads to problems? And if left untreated, it's going to cause more pain and disc issues. That's how you need to start documenting this. And then throughout the course of care, you can start using the site to drip in more references. Do one or two in the beginning. Nope, I started it. Oh, I talked to the patient again about it at table talk. I talked to him about how the loss of curve does come from crashes. Maybe there's another study you put in there to just keep increasing your knowledge so that your notes reflect your knowledge, right? So now, flexion extension. Let's do this. Everyone talks about AOMSI. Okay, big deal. They have AOMSI. It's a 25 to 28% disability. Nobody cares. Why is this disabling the patient? What does it mean? Do some people with arthritis and not in a crash have instability? Why is this from the crash? What does this pathology mean? Okay, great. You have this x-ray. Okay, they're going to hire an IME that says, hey, I looked at the x-ray and I said just as much as the doctor, which was nothing. So I think it's not really that big of a deal. And it's hard for you to now fight back because you didn't give them the information, hit them first, so to speak, with education. And you have these measures. Oh, it's AOMSI. It's a 25 to 28%. Nobody cares. How is it causing disability in your patient? How is it affecting their quality of life? Is this truly a pathology that is linked to problems? So let's do a soap example. Same type of thing. Look, boom. Dynamic elements right off the site. Dynamic elements can magnify the static components of canal deformation. An already compressed spinal cord can sustain further damage when exposed to longitudinal cord tension or repetitive flexion or extension. As a chiropractor, if you're causing longitudinal distraction, according to Journal of Neurosurgery, is that a simple soft tissue injury? Is that a 25 to 28% whole body rateable impairment? I don't care what number you put. I don't want my spinal cord being tethered. And then what happens? Furthermore, these motion related factors that you did an x ray for, what does the study say? Can reduce space, but can also compromise capillaries and microvasculature that maintain a steady supply of oxygen and nutrients to the spinal cord. That's from the impact of dynamic alignment, motion, and center of rotation of myelopathy grade and regional disability in cervical spondylotic myelopathy from Journal of Neurosurgery. So here's their instability. You send them out for an image. Now I'm explaining why that can lead to neurological issues. How many of your patients after a crash or with instability have irritation, sensitization? Could that be from longitudinal distraction? There's tons of studies on here that talk about it. You go to instability and under it, just do neurovascular compromise. Talk to your patient. Hey, Mary, I know you have pain. Remember when we took those x-rays? Well, what that does is it causes the vertebrae to slip and it can irritate the canal, leading to a change in blood supply. You're not selling them. You're educating them on your knowledge. And then you're going to take something from that study to put in your notes. So now your notes reflect it. So in a month, they're like, we don't want to pay your bill. Or someone's arguing for whatever. Look, I explained what the magnitude of this. And it's not just my opinion. The IME that you hired is using no research and it's their opinion because they're paid for that. Why are they ignoring Journal of Neurosurgery and other stuff, right? And as you can see, this is just what it looks like on the site with the whole video, right? And then here, I'm going to show you just, again, same thing. I know I'm beating it home, and I should beat it home because I want your notes to be better. You're so much better than pretty much any other providers that are out there, but your notes don't reflect it. And then they're asking you for 40% off because they're like, you didn't do this. So here we go. Oh, someone's saying that someone was telling me there's no volume. I could hear it perfectly. I don't know what happened there. But again, you can see how quickly it is to show that, to explain it. And Taylor, my man, thank you so much. Text me if there's a problem. So I appreciate that. I don't know why it dropped down. I can hear it perfectly. But so again, it's that easy just to show and break it down, right? There's evidence that a crash can damage the ligaments leading to instability. You're not arguing anymore. Oh, that's no big deal. It's just soft tissue. Causation, we don't think we caused it. Well, here's evidence that an impact like that actually does cause it. So it's great that you're paid to give your opinion, but let's take a look at the science and literature and talk to your patient about, hey, Mary, I keep up on this. I understand that these things happen. Let me show you. And we show them this, right? So let's keep, so same thing with MRI, right? This is a guy who just came in, who's involved in a crash, and we'll put arrows too, right? If we copy, I'll put an arrow like here's the torn disc. Here's the torn disc on this side. And then sometimes we'll even talk about, if they have fatty infiltration of the multifidus muscles. Like, okay, so they have a disc bulge. Okay. A lot of people have disc bulges that don't hurt. Why is this one symptomatic for your patient? Why was this one? And the same type of thing, you're going to go onto the site. Well, I'm not going to go through another video. Very similar. But when you're taking these images, you're sending a patient for the images, make sure your notes reflect what the image showed, not just some radiology report, not just AOMSI. Oh, here's from causation. Here's right from the site. Here's low impact crash, disc, and tissue irritation. Look what it says. Copy and paste one or two of the sentences from it. We know that crashes have been shown to cause damage to the disc and tissue irritation. Look, here's one from, I just typed in MRI in muscle, right? MRI findings in motor vehicle crash and non-motor vehicle necks. Here's lumbar lordosis and muscle atrophy, WOD patients and MRIs, supine versus prone disc herniations. There's so much evidence on here. How much does an MRI change over a period of up to 2 years, right? They actually showed that they do get worse. They do end up with pain. So, how does your treatment, what does that mean? Why is that important? So, for all these findings, when you're sending out for an image, just make sure you take the 30 seconds that it could take using my site to be like, all right, here's causation, here's neurovascular issues, here's how it could become chronic, here's how it can relate to joint issues, and boom, and it's on there, right? Same thing, facet inflammation and pain on MRI. We did a whole webinar. This one was an hour, well, an hour and a half long, just part one on going over static X-rays and MRIs. What do they mean? What is the findings? What does the research show? How can you put in your notes? Type in soap. Here's a whole soap notes tutorial. I don't know how many webinars I have on soap notes for this site, right? So, and I'm going to get to, after this, I'm going to go over some Q&A if anyone still has, if you didn't all fall asleep. But again, for you people that are non-members, for less than one patient visit, if you want stronger information, right? Designed to educate and engage your practice and engage yourself and your knowledge. You don't want just simple sales tactics. You want full live and on-demand webinars, 24/7, 365, constant education at your fingertips, constant clinical resources, practical info that you can use right away, from forms to billing webinars to what to do during consultations, how to do initial evaluations for different pathologies, how to document your initial evaluation, ways to do better documentation and to improve your accuracy for your knowledge, compliance. You want coaching and mentorship from me, a chiropractor with over 25 years of experience and practice, going to court 50 times, fighting for chiropractic, having my notes criticized so I know what works, and I can validate. I've validated over 206 visits in court, and so much more. Has more than anywhere. Just join professionally integrated. There's a quick QR code. Scan it and go right to the site. So and become a member, right? I don't have contracts. If you're not using it, that's on you. If you don't think you can get the value out of it for starting at $125, give me a call, because you should make this money back with one patient. So let me go to this here, and I'm gonna stop and see if anyone has any questions, right? I'll start with that first. I think someone did ask, and it may have been saying there wasn't any sound. Hopefully you can hear it now. Um, I hope you can all hear that because if not, that would really suck. Um, uh, yeah, if not, that would be terrible. So anyway, if does anyone have any questions, right? I just want to give you that information. Hope that you found it valuable. Hope that you can use it. I got a couple questions on text here, so it sounds like most of you can hear this. So yeah, so it is that simple and easy to use. So I do that. Someone's asking here, do I do that with all images? I do it on the images that show a problem, right? So I do. If I'm going to take the time to send a patient or do an image, I'm going to make sure that my notes reflect what it means, right? And there's super simple ways on the site to do it. Now, do I do it on every MRI slide? No. The slide that seems to be pertinent and correlates to their findings, then yes, I'll talk about that slide, right? Same thing on if I do an X-ray or a DMX or a CT scan. The view that shows there's a problem, yeah, I want to talk about that. I want my notes to reflect that because if they don't, you can't really talk about it. And there's no real value behind it. Um, not that I don't want to say value from a payment perspective, um, but the patient came to you and they're like, all right, you're sending me for an image. I'm going to pay for this image. Why? Your notes should reflect that. Oh, this was really important. We understand now that you have a loss curve. We understand now that you have instability, a disc injury, whatever it is. Here's evidence that shows that this leads to some problems. So yeah, we do it on every image. Super simple, right? Don't wait for you to get questioned a year down the road to answer their questions that say, I think it's all bullshit. Give it to them up front. Let them read your notes and then say, yeah, I think it's all bullshit. Like, really? All the evidence and research and the images, you think it means nothing? Based on what? Why did Journal of Biomechanics or Journal of Neurosurgery not mean anything? So yeah, make sure you do that. And we do it on patients that aren't car crash patients. Same thing. Give the same level and standard of care to everybody. What does it mean? And make sure, and again, it's just another policy, insurance policy covering your butt. Your notes have a little bit more to help you protect yourself. So I hope you found that beneficial. For those of you that aren't members, man, hop on. If you have any questions, let me help you use the site. Like everything, it takes a little bit of learning curve, but you have everything you can possibly need to use the site to make your notes better, make your knowledge better, make your practice better. And again, the same thing we were talking about, let's say it was instability. Instead of even going to the search bar, there's here causation, chronic joint neurovascular. Like, oh, you have a patient with instability and they have nerve issues. Look, it goes right to neurovascular. Here it is. Here's a bunch of stuff, right? And they have, and then even down below, I'm starting to put um, patient handouts that we do in our office. We just copy all of this, put our heading on it, print it out, put it at the front desk, and talk to patients like, oh, you have someone with headaches and neck pain, and you can see how, and here's how we can help you. That's for all members. Again, 125 bucks. So anyway, I don't want to hold you all up. I super appreciate all of your time, and it looks like no one else has any other questions. Hopefully, you were all able to hear this, and yeah, reach out. Let's show the world like how important chiropractic is, and the evidence is here to really support us, support our patients' pain and decrease in quality of life from true spinal pathologies and spinal subluxations. So anyway, hope you found that beneficial. Looks like there's no more questions. If you want more, there's way more webinars and longer ones. And if you have any topics that you want me to go over, um, please ask and I will cover that topic. If it wasn't already covered, or I can cover it from a different angle. So thank you all so much. And yeah, reach out. You have my number. You can reach me on Facebook, email, all that stuff. Look forward to seeing you all soon. Have a good one.